Welcome back to the Living Diabetes podcast. I am your host, and today we are tackling something that affects every single person with diabetes but rarely gets the attention it deserves. We are talking about stress, specifically cortisol, and how it directly impacts your blood sugar. If you have ever noticed your glucose spiking during a stressful day at work, or your numbers running high when you are dealing with family problems, or your A1C creeping up during a difficult period in your life, you are not imagining it. Stress has a real, measurable physiological effect on blood sugar, and understanding this connection can genuinely change how you manage your diabetes. So let us start with the basics. What is cortisol? Cortisol is a hormone produced by your adrenal glands, which sit on top of your kidneys. It is often called the stress hormone, but that is a simplification. Cortisol is essential for life. It helps regulate your metabolism, your immune system, your blood pressure, and your sleep-wake cycle. The problem is not cortisol itself. The problem is when you have too much of it for too long. When you experience stress, whether it is physical stress like an illness or injury, or psychological stress like financial worries or relationship problems, your body activates what is called the hypothalamic pituitary adrenal axis. That is a chain reaction that starts in your brain and ends with your adrenal glands releasing cortisol into your bloodstream. Now, here is where it connects directly to diabetes. Cortisol does several things that raise blood sugar. First, it triggers your liver to release stored glucose through a process called gluconeogenesis. Your liver starts manufacturing and dumping glucose into your blood. This is a survival mechanism. Your body thinks you are in danger and wants to make sure you have energy available. But if you are sitting at a desk stressing about a deadline, that extra glucose has nowhere to go. Second, cortisol makes your cells more resistant to insulin. It literally reduces the ability of insulin to move glucose into your muscles and fat tissue. So not only do you have more glucose in your blood, but your insulin is less effective at clearing it. This is a double hit. Third, chronic stress promotes inflammation, and inflammation itself contributes to insulin resistance. So you end up in a cycle where stress raises cortisol, cortisol raises blood sugar, high blood sugar causes more inflammation, and inflammation makes insulin resistance worse. It feeds on itself. The clinical evidence for this is solid. Studies have shown that people with type 2 diabetes who report higher stress levels have significantly higher A1C values compared to those with lower stress. And this is not just about lifestyle. It is not just that stressed people eat worse or exercise less, although that happens too. The hormonal effect is independent. Even if you eat perfectly and take all your medications, chronic stress will push your numbers up. For people with type 1 diabetes, the effect is equally real but can be unpredictable. Stress can cause glucose spikes, but in some individuals it can also lead to drops, particularly if stress affects appetite and eating patterns. This variability makes stress management even more important for type 1 patients who are already dealing with significant glucose fluctuations. So, what can you actually do about it? Let me give you some practical strategies. First, recognize the pattern. Start paying attention to your stress levels alongside your glucose data. If you use a continuous glucose monitor, look for patterns on stressful days versus calm days. Many people are surprised by how clearly the correlation shows up in their data. Awareness is the first step. Second, address the source when you can. This sounds obvious, but we often accept chronic stressors as unchangeable when they are not. Whether it is setting boundaries at work, having a difficult conversation, or making a life change, reducing the actual source of stress is always the most effective intervention. Third, build in regular stress reduction practices. The research supports several approaches. Regular physical activity is probably the single most effective stress reducer that also directly improves blood sugar. Even a 20-minute walk can lower cortisol levels. Deep breathing exercises activate the parasympathetic nervous system, which counteracts the stress response. Progressive muscle relaxation, where you systematically tense and release muscle groups, has been shown to improve glycemic control in diabetic patients. Fourth, prioritize sleep. Sleep deprivation is a major cortisol driver. When you do not sleep enough, cortisol levels remain elevated the following day, and insulin sensitivity drops measurably. 7 to 8 hours of quality sleep is not a luxury. For someone with diabetes, it is a metabolic necessity. Fifth, talk to your doctor about it. If you are going through a particularly stressful period and your numbers are running high despite good adherence to medication and diet, tell your healthcare team. They may need to temporarily adjust your treatment. Trying to chase stress-induced high blood sugars with extra medication without addressing the underlying cause is a losing strategy. The key takeaway is this: stress is not just a feeling. It is a hormonal state that directly interferes with blood sugar regulation through multiple mechanisms. Managing stress is not a soft optional add-on to your diabetes care. It is a core component as important as medication, diet, and exercise. Follow us on social media for daily updates and more content. Until next time, take care of yourselves.